Hello everyone, continuing our lectures on renal disorders. Today we are going to discuss about chronic renal failure. How do you define uh, chronic renal failure? It is a progressive irreversible deterioration in renal function in which the body's ability to maintain metabolic and fluid and electrolyte balance fails, resulting in uremia or azotemia. So we define it as CRF, that is chronic renal failure, or end stage renal disease. Looking into the definition again, you'd be quite sure about it that it is a progressive disease, so it doesn't stop at a particular point. It will continue to be same, or it will progress, or it will worsen as the time passes. There is an inability of the body, or we can say it is the inability of the kidney to maintain the metabolic and fluid and electrolyte balance, which results in uremia or azotemia. Azotemia is basically a term used to define elevated level of nitrogenous waste in the body, like urea. Chronic or irreversible renal failure is a progressive reduction of functioning of renal tissue such that the remaining kidney mass can no longer maintain the body's internal environment. So, whatever has been the pathology behind the development of chronic renal failure, but what happens is that a particular part of the kidney or a portion of the kidney or a certain percentage of the kidney is not functioning, and the rest of the percentage or the rest of the kidney part is unable to maintain body's internal environment, which should be free from the toxic substances. Now let us look into the etiology and the risk factors associated with development of chronic renal failure. The first and the foremost is decreased renal blood flow. Any disorder, any condition which is reducing the amount of blood flowing to the kidney will lead into progressively or over the time or over a period of time will lead into renal failure. There can be other systemic diseases which is an added risk factor for development of chronic renal failure, and that can be diabetes mellitus, hypertension, SLE, that is systemic lupus erythematosus, polyarteritis, sickle cell anemia, amyloidosis, glomerulonephritis, pyelonephritis, and acute renal failure. So, any acute renal failure extending to a quite a longer period of time would turn eventually into the chronic renal failure. There can also be reasons like obstruction of the urinary tract, and it can be due to any tumorous growth or an obstruction due to nephrolithiasis. Other hereditary lesions like polycystic kidney disease, also in short known as the PKD, polycystic kidney disease, infections at various level of the body might also turn up to be a risk factor for development of CKD. Vascular diseases, medication and toxic agents, environmental and occupational agents might also contribute, like lead, cadmium, mercury, and chromium are known to cause CKD. Now, let us first look into the pathophysiology of development due to etiological factor. The pathophysiology, which is developed due to the etiological factors, whatever has been the cause for the development of CKD, it decreases the glomerular filtration rate and causes hypertrophy of the remaining nephrons. That causes nephrons inability to concentrate urine, and there would be further loss of the nephron function, which will eventually lead into loss of non-excretory and excretory functions of nephron. So it's an progressive disease. That means once the disease starts, it leads into the other complications. Also understanding the pathophysiology, there is a decreased renal blood flow and the primary kidney disease damages or from other diseases, urine outflow becomes obstructed. That decreases glomerular filtration rate, which will obviously lead into hypertrophy of remaining nephrons. It leads into inability to concentrate urine. There will be further loss of nephron function and loss of excretory renal function and non-excretory renal functions. This is how the pathophysiology of chronic renal failure works like. So the ultimate um, recognition point to develop or to establish chronic renal failure is to measure glomerular filtration rate. So what happens with the glomerular filtration rate? So stage one and stages of how the stages two progress. So we can use this staging depending on the amount of uh, glomerular filtration. Stage one, stage two, stage three has two parts with variable amount of GFR. Stage 4 and stage 5 are also there. So stage 1, the GFR is more than 90 ml. Stage 2 with mild CKD, 60 to 90. The stage 3A will have 45 to 59 and stage 3B will have 30 to 44. Or overall, if we say stage 3, so it's between 30 to 59. Stage 4 is a severe, that is 15 to 29 ml per minute, and stage 5 is less than 15 ml per minute of GFR is left. Now, stages of chronic renal failure, there is a reduced renal reserve. There is BUN is high or normal. The, as such, the client might have no complaints, and 40 to 75% loss of nephron function would be present. There might also be renal insufficiencies like 75 to 90% loss of nephron function. So that will cause the renal insufficiency. And second, impaired urine concentration would be seen. Nocturia, mild anemia, increased creatinine and BUN quantity would be seen. Renal failure, the third stage, where severe azotemia would be seen, that is, the urea and nitrogenous waste level of the blood will rise immensely. Impaired urine dilution, severe anemia would be seen with electrolyte imbalance, hypernatremia, hyperkalemia, hyperphosphatemia, and the last one is the end stage renal disease, where 10% of the nephrons are functioning and multi-system dysfunction can be seen. Now, as we have discussed, there would be a loss of excretory as well as non-excretory functions. Now, let us first look into loss of excretory renal functions and what are the impacts of that. So, first of all, we'll see the disturbance in the reproduction. There is a loss of libido and infertility might be seen. Immune disturbance can be seen like delayed healing and recurrent infections. Also, there would be an increased production of lipids that would eventually lead into exaggeration of, or there is increase in the atherosclerosis if present, or it will initiate the process of atherosclerosis. Also, there is an impaired insulin action that causes an abrupt rise in the blood glucose level. There is a failure to produce erythropoietin, which eventually would lead into anemia and pallor, and also failure to convert inactive form of calcium. It is decreased calcium absorption, osteodystrophy, and hypocalcemia. Now, also there are a loss of non-excretory functions. Like, what are the non-excretory ones? There is decreased hydrogen secretion and decreased bicarbonate. reabsorption, that is metabolic acidosis might be seen. Decreased phosphate excretion, that is hyperphosphatemia, will lead into decreased calcium absorption, which will cause hypocalcemia, which in turn increases the increases the secretion of parathyroid. So hyperparathyroidism can be seen. Decreased potassium excretion, which will lead to hyperkalemia, which will eventually lead into hypertension. Decreased potassium excretion, that is the condition is known as hyperkalemia. Decreased sodium reabsorption in tubule, that is water retention, causing hypertension, heart failure, and edema. And decreased excretion of nitrogenous waste. That is, uremic causes increased BUN, creatinine, uric acid, proteinuria, peripheral nerve changes, pericarditis, pleuritis, CNS changes, bleeding tendencies. Now, let us have a quick look at the clinical manifestations of chronic renal failure. First of all, we'll see into the inflammatory changes or the changes we can see on the skin. Skin usually becomes very dry because of atrophy of sweat glands. Pruritus, as generalized itching might be seen with excoriated skin due to itching. Skin color as urochromus, pigments, and mucous line and uremic frost might also be seen. So, mucous line, you can see the bands on the nails, also excoriated skin, and be seen and due to the itching. The first picture on the top, this picture, you can see here, you can see the lines, mucous line. It is due to excessive deposition of the nitrogenous waste. There are also certain musculoskeletal changes, like that is known as renal osteodystrophy, which can cause osteoporosis, as we have discussed that uh, there is decreased deposition of calcium, or the absorption of calcium has been hampered. So it might cause osteoporosis, osteosclerosis, osteomalacia, and osteitis fibrosa. Also, there might be hematological changes like anemia, which will lead into fatigue, weakness, cold intolerance, as kidney are not producing erythropoietin. We might also see clotting abnormalities and bleeding tendencies as accumulation of uremic interferes with platelet adhesiveness. So, bleeding disorders and clotting abnormalities are quite common. Some immunological changes, like they become more susceptible to infection, and suppression or delayed hypersensitivity might also be observed. Metabolic changes, that normal ratio of BUN to creatinine is 10 is to 1, which was again around 20 is to 1. As the concentration of nitrogenous waste has increased, hyperproteinuria, increase serum uric acid, carbohydrate intolerance, and metabolic acidosis as kidney fail to excrete hydrogen ion are seen. Cardiovascular changes like hypertension, development of atherosclerosis, left, left ventricular dystrophy, and heart failure due to volume overload, accelerated due to abnormal lipid metabolism, it is arterial calcification, might also be observed. Respiratory changes like pulmonary edema, uremic lungs, deposition of nitrogenous waste in lungs, metabolic acidosis as a result of respiratory change to hydrogen ion. We can also see gastrointestinal changes like anorexia, nausea, vomiting, constant bitter, metallic, or salty taste is experienced. Breath uremic fetor, like ammonia like smell, fishy like smell can be seen. Constipation and ulceration are also common. There are certain neurological changes also, so that can lead to peripheral neuropathy, that is burning fat, gait changes, paraplegia, that is a normal gait with which the person walks. So it won't be walking straight, it would be some unusual way the person would be walking. Impaired cognitive functions, like there might be some obstruction in vision, or all the senses might be affected. Psychological changes like financial stress, lifestyle changes are also upset. We'll continue the other portion in the coming second part of chronic renal failure. Thank you for listening.